Tonight on Left Hook, Right Jab, we're talking about the future of health care in our country. Senator Bernie Sanders this week introduced his bill to create a single-payer health care system, the plan known as Medicare for All. And Oregon Senator Jeff Merkley has signed on as a co-sponsor. All right, we have KXL's Lars Larson with us and former City Commissioner Steve Novick to debate the plan. Is the Medicare for All plan a good idea for the country? Steve, you go first.
Medicare works pretty well. Why shouldn't everybody have it? The United States spends an insane amount of money in health care. We spend 17% of our total national income. No other rich country comes close. If we spend a normal amount on health care, then every man, woman, and child in America could have an extra $3,000 a year to spend on something else, like maybe universal child care. And we don't get good results. We have lower life expectancy than France or Germany or Great Britain or Canada. Now, in some of those countries, you have Medicare for all. Government is the only insurer. In some of them, government provides a basic level of insurance and people buy some additional insurance. But in all of those countries, they have regulations on the prices that drug companies and hospitals and doctors can charge. And if we're not going to have healthcare eat the entire economy, we need at a minimum to have some control of those prices.
Steve, I got to tell you something. I love it when you can forward an opinion without looking at the actual numbers. The estimated cost of Senator Bernie Sanders, remember he's the commie from Vermont, the estimated cost per year of Medicare for All, $3 trillion at a minimum, $4 trillion more realistically. The entire budget of the federal government is $4 trillion. So you're talking about, at minimum, increasing the federal government's budget by 75%. And that $3,000 you talked about the family having, the average family's taxes will go from $10,000 a year to $18,000 a year. You'll not only lose the $3,000 Steve was talking about, you'll be $5,000 in the hole. All of that to get government run by the same people who run Amtrak, the post office, and the DMV. It's a terrible idea.
Well, Lars, under our healthcare system, we spend $9,000 per person. So for a family of three, that's $27,000, which is half again the $18,000 you just listed in taxes. So you've just proved my point. We have a system where we spend more money than any other country and we don't live as long. That's ridiculous. We need to go to a system like other countries have where healthcare is not eating the budgets of business. You know, Warren Buffett pointed out that healthcare costs are a much bigger burden on the American businesses than taxes are. You should be worried about the impact of healthcare on American businesses.
Steve, if you like the Michael Moore model, if you like socialized medicine that much, move to Cuba. They've got socialized medicine. Or better yet, go to Great Britain. I checked the British newspapers this week. The average wait time to see any kind of specialist is 4.5 months. Now, that's convenient for the government because if you have a heart condition and it takes you 4.5 months to see a specialist, the British government, the National Health Service, actually tells you 5% of you will die while you're waiting in line to see a doctor. That's not the kind of health care I want for America, and America cannot afford a $3 trillion a year health care plan.
And according to the survey that you sent me, wait times in America are worse than in Britain. They're worse than in any other country except Canada.
All right, gentlemen, thank you very much.